Prostate cancer is a malignant disease that can be serious. It affects men in adulthood. It begins in the prostate gland, which is located below the bladder. It occurs when cells grow uncontrollably. These cells form a tumor that can spread. Early detection offers the best chance for a cure. The prostate gland, often described as the size of a walnut, plays an essential role in the male reproductive system. This small gland, located just below the bladder, is responsible for producing a fluid that nourishes and protects sperm. This fluid, together with sperm from the testicles, forms semen.
Changes occur in the prostate gland throughout a man's life. During puberty, it grows to its adult size. As men age, the prostate can continue to grow, sometimes leading to health problems. Knowing the function of the prostate gland is crucial for the overall health and quality of life of men. Regular checkups and open communication with a healthcare professional are essential to maintaining prostate health.
Prostate cancer is described as a silent enemy.
In its early stages, there may be no symptoms. This makes regular screening even more important. As the cancer grows, it may begin to press on the urethra. The urethra is the tube that carries urine from the bladder. This pressure can cause difficulty urinating. Men may experience a weak stream, difficulty starting or stopping urination, or frequent urination, especially at night. It is important to know that these symptoms can also be caused by other less serious conditions. However, if you experience any of these symptoms, it is important to see your doctor immediately. Early detection is essential for successful treatment of prostate cancer.
The history of prostate cancer dates back centuries. Ancient Egyptian texts mention urinary problems.
In the 19th century, doctors began to understand the prostate gland. In 1853, Eugène François Dubois described the prostate. In 1905, the first radical prostatectomy was performed. Medical advances in the 20th century led to new diagnostic tools. The PSA test in the 1980s revolutionized early detection. Today, researchers continue to make progress in understanding prostate cancer.
Risk factors and genetic predisposition. The precise causes of prostate cancer remain unknown.
However, researchers have identified several factors that increase a man's risk of developing it. Age is a significant risk factor, with most cases diagnosed in men over the age of 50. Family history also plays a role. Men with a father or brother who has had prostate cancer are at higher risk.
Race and ethnicity are also factors. African American men have the highest rates of prostate cancer, followed by Caucasian men.
Asian and Hispanic men have lower rates. Although lifestyle factors may have an influence, further studies are needed. Maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity are general recommendations for overall health.
Symptoms of prostate cancer. Early-stage prostate cancer usually has no noticeable symptoms. This makes regular screening essential, especially for men over 50 or those with risk factors. As the tumor increases in volume and infiltrates the prostate tissue, it can press on the urethra, causing urinary problems.
These urinary symptoms may include difficulty starting or stopping urination, a weak or interrupted stream of urine, a frequent need to urinate, especially at night, pain or burning when urinating and blood in the urine or semen.
However, any change in urinary habits should be reported to the doctor immediately for timely evaluation and diagnosis.
Diagnostic tools in prostate cancer. Diagnosing prostate cancer involves a combination of tests and procedures. The first step is usually a digital rectal exam, in which the doctor physically examines the prostate to detect any changes in its volume, consistency, symmetry, mobility, and sensitivity. A blood test is usually performed next to measure prostate-specific antigen levels, but they can also be caused by other factors. If these initial tests raise doubts, further investigation is necessary. A biopsy, in which a small sample of prostate tissue is removed and examined under a microscope. It is the most definitive way to diagnose prostate cancer. Imaging tests may also be used, such as ultrasound or magnetic resonance imaging, to visualize the prostate and assess the extent of the cancer.
Early diagnosis of prostate cancer is based on a tripod consisting of digital rectal touch, PSA, and transrectal ultrasound. Early detection is essential in the fight against prostate cancer. The earlier cancer is detected, the greater the chances of successful treatment and a favorable recovery. There are three main tools that play a key role in early detection: digital rectal examination, PSA test, and transrectal ultrasound. The digital rectal exam allows the doctor to palpate the prostate to detect any increase in its consistency and asymmetric enlargement. The PSA test measures the level of a protein produced by the prostate in the blood, and elevated levels may indicate cancer. Transrectal ultrasound, a more advanced imaging technique, provides a detailed image of the prostate gland, helping to identify any abnormalities. These three tools, used together, offer a comprehensive approach to the early diagnosis of prostate cancer.
Treatment options. Treatment for prostate cancer varies depending on the stage and aggressiveness of the cancer, as well as the patient's overall health and preferences. Treatment options may range from watchful waiting to surgery, radiation therapy, and hormone therapy. Watchful waiting involves closely monitoring the progression of cancer without immediate treatment. This approach may be suitable for slow-growing cancers in older men. Surgery to remove the prostate gland, known as radical prostatectomy, is a common treatment for localized prostate cancer. Radiation therapy uses high-energy rays to destroy cancer cells, while hormone therapy targets the hormones that fuel the growth of prostate cancer.
Drug treatments targeting cancer cells. Drug treatments play an important role in the treatment of prostate cancer, especially in advanced stages. Hormone therapy is a cornerstone of treatment because prostate cancer cells depend on hormones, especially testosterone, for growth. Drugs known as luteinizing hormone-releasing hormone agonists and antagonists work by reducing testosterone production or blocking its effects on cancer cells. The advantages of LHRH analogs include their efficacy, their excellent tolerance profile, their convenience, the lower psychological impact they produce on the patient compared to castration surgery, and the possibility of reversibility of the blockade. The main side effect of any treatment that removes testosterone is impotence and loss of libido as a general rule. The presence of hot flushes, gynecomastia, loss of body hair, and weight gain are very common occurrences with treatment. External radiotherapy is an effective weapon for the treatment of localized and locally advanced prostate cancer. Low-dose brachytherapy involves placing seeds of radioactive material inside the prostate parenchyma through the perineum and guided by transrectal ultrasound. Chemotherapy, which uses powerful drugs to destroy rapidly dividing cancer cells, may be recommended for advanced prostate cancer that has spread to other parts of the body. Targeted therapy drugs, designed to specifically attack cancer cells while sparing healthy ones, are also emerging as promising treatment options.
Surgical interventions. If you like our content, give us a like, subscribe, activate the bell, and share this video so more people can see it. Surgical interventions for prostate cancer aim to remove the cancerous tumor and prevent it from spreading. The most common surgical procedure is radical prostatectomy, which involves removing the entire prostate gland and nearby lymph nodes. This surgery can be performed using different methods, such as open surgery, laparoscopic surgery, and robotic-assisted surgery. The choice of method depends on factors such as the stage of the cancer, the experience of the surgeon, and the general health of the patient. Although radical prostatectomy can be very effective in treating localized prostate cancer, it can also cause side effects such as urinary incontinence and erectile sexual dysfunction. Incontinence is mainly due to the loss of the internal sphincter, erectile sexual dysfunction due to injury to the erectile nerves that run in the posterolateral portions of the prostate. Other complications of surgery include urinary fistulas, rectal injuries, and bladder neck obstruction. Your doctor will explain the potential risks and benefits of surgery and help you make an informed decision about your treatment.